Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. Are you the parent of a young child or a teenager? Do you have any healthcare questions? Find out all your answers right now. My guest this evening is Dr. Alan Gober, a noted pediatrician practicing here right in Montgomery County. Alan, welcome to Housecall.
Thank you very much, David.
So, briefly, tell our viewers about your professional background.
I am a graduate of the University of Maryland School of Medicine. Did my residency in Cincinnati and then came to the Washington area where I did a fellowship subspecialty in critical care medicine. After that, went into practice here in Montgomery County.
And how long have you been practicing?
I've been about 39 years.
Good for you. Thanks for your service to the community.
My pleasure.
So one of the very hot topics now is vaccinations and their safety. Would you please share with our viewers the latest position from the American Academy of Pediatrics?
Yes, the vaccines are critical importance, extremely safe, been researched by multiple countries, departments of health, and they have been shown to be highly effective in eliminating or nearly eliminating many diseases. In recent years, though, recent months, we've had a major problem, as everybody's heard by now, with measles. And measles is a disease which was presumably wiped out in the Western Hemisphere in around 2000. But in the last year, or maybe even less than that, there have been a resurgence of cases due to the fact that the immunization rates have fallen. And because of that, there has been a resurgence of the disease. It's very critical to realize that measles is one of the most contagious diseases known. Mm-hmm. It doesn't take very much exposure to develop a case of measles. If one person with measles enters a room of 100 people, 95 to 100% will develop the disease if they've never been immunized. Mm-hmm. So the problem we're having now is that there are so many children whose parents have, for whatever reason, decided not to immunize their children. And as a result, one case of measles comes and it starts to spread, and we are on the verge of an epidemic.
Yeah. Share with the viewers some of the reasons you've heard for someone not to get vaccinated.
Many of them are philosophical, without true knowledge of the effects of the vaccine. There's been a controversy about the measles vaccine causing autism. Mm-hmm. That has been disproven over and over again by multiple countries, and as a result, vaccine rates started to come back up somewhat, but there's still a core of people who believe that the vaccine will cause autism. There are many people, for varying reasons, religious reasons, or the feeling that the disease doesn't exist anymore. Why expose my child to these chemicals and foreign proteins? And these are all really unfounded reasons for doing so.
And to expand on your comment about this disproven theory about autism, as you know, the original paper was published by a physician in the Lancet.
Yes.
In England.
Dr. Wakely.
Right. And not only was that paper disproven, not only did he have to subsequently write and have published a retraction, but he ultimately lost his medical license.
Correct.
In England.
Correct.
Much to everyone's chagrin, though, this urban myth is perpetuated, yes, including, by the way, by President Trump.
That is correct.
During the presidential debates in 2016, mm-hmm, despite all the science, he still perpetuates this urban myth.
That's one of the problems we're having right now.
Yeah.
Yes.
So let's circle back to measles. Some people may say, well, wait a minute, I had measles when I was a child and I got through it before there was vaccination. What do you say to these parents, first of all, about what can happen to a child who contracts acute measles? And probably even more important, what about a young adult or an adult who contracts measles? Is it the same illness?
Excellent question, because measles is a very, very dangerous disease at all ages, but it gets more dangerous the older you get. Children that get measles, it is a terrible disease. I remember having had measles. I don't remember having had chickenpox, mumps, or German measles, but measles was such a horrible experience. I was sick for a week with extremely high fever, hallucinations, and it did...
Don't forget the rash.
and certainly a horrible rash and
Yeah.
everything else to go with it.
Yeah.
But it is a devastating disease. Everybody says, oh, I got through measles. Well, those of us who got through measles are the lucky ones, because there's a significant incidence of brain damage following it, if not death.
Sure.
So we are very, very scared of this disease, and we hope that people will go out and get their children immunized.
And it's never too late to get immunized.
Never too late to get immunized. Even if you've been exposed, the recommendation is to get immunized, and hopefully you'll get some protection from that.
Very good. Let's shift gears then to discuss common questions parents have about young children, even infants, that I'm sure you hear each and every day. Let's start out by discussing infantile colic. What exactly is that, and how do you treat it?
Right. Infantile colic is an extremely common problem. A lot of definitions for it, but there was a conference in Rome. It's called the Rome Conference. Pediatric gastroenterologists got together and discussed various things, and one of them was infantile colic. And they decided that there were some criteria they put together based on lots of research. A child had to be less than 5 months old. The crying that occurs has to occur more than 3 hours at a time per day for at least 3 days a week, and persist probably for 3 weeks. The crying is generally not triggered by anything, and there's nothing you can do to stop it, and there's nothing you can do to prevent it. The most important thing, though, is that there is nothing wrong with the child. It's very important that these children get evaluated by their pediatrician to determine that they're a healthy, growing child with absolutely no signs of any illness. So the problem is then, what do you do about it?
Yeah.
There have been some research in recent years to show that there may be some benefit from changing the intake that the baby gets, whether it's breastfeed milk or formula. One of the problems has been shown that milk protein perhaps can cause some of these cases of colic. So what we do with breastfed mothers is we tell the mother to stop taking in all milk and milk protein. That means cow's milk, including goat's milk, which somewhat shares some of the proteins of cow's milk. And also, if they're formula fed, we go to a special type of formula, which is called a protein hydrolysate formula, where they take the milk protein actually and chop it up into tiny particles so it's not even recognizable. Nutritionally, it's exactly the same, but it doesn't cause the same type of effect.
So have they done longitudinal studies of infants with colic to determine long-term if they go on to adult lactose intolerance?
No, they actually do not. They are actually just fine. Once they get through this 3 to 5 month phase of crying, they end up being just fine, and they actually do not develop the lactose problem. Lactose intolerance, as you know, being your specialty, it's a condition that develops as you get older. You lose the ability to digest milk. The lactase enzyme seems to give out. It happens somewhat in childhood, but less commonly.
Sure.
Occasionally, it can be temporary following a severe intestinal viral gastroenteritis. But generally, these children with colic, they get through it and do just fine.
Terrific.
Yes.
So you mentioned presenting with colic with extended crying. Aside from the kiddies that have colic, parents, especially first-time parents, will wonder, what is an acceptable amount of crying? At which point do they have to bring the baby to your attention? So what do you tell your parents?
A normal baby will cry up to 3 hours in a 24-hour period. That seems like a lot when you put it all together, but most of the time it's not an extended time of crying. And it may very well not be repetitive. There may be days when the baby doesn't cry very much, and other days when he cries a lot more, he or she cries a lot more. And it may be variable in terms of the type of crying. Babies cry for a lot of reasons. After all, they don't talk, and they communicate by crying. So if they're hungry, if they're tired, if they're cold, if they're wet, if they just need extra TLC, they'll cry. And we have to realize, and moms and dads have to realize, that a certain amount of crying is acceptable. But if it appears that it seems to be excessive, then it's time to contact the pediatrician and get that assessed.
When is it reasonable for parents, especially first-time parents, to expect that their child will sleep through most of the night?
Most babies will sleep through the night by 3 months, and sleeping through the night is defined as sleeping minimum 6 hours in one stretch.
Okay.
So generally by 12 to 13 pounds is what is discussed, but 3 months is usually the time. A lot of variation though. There are many babies that will sleep through the night. It's 3 weeks, and some may take a year, poor souls.
Yes.
But there is a lot of variation, but most parents can expect their child to sleep through the night by about 3 months.
I know the position of the Academy over the years has kind of varied about pacifiers. Educate our viewers about the latest position of the Academy and pacifiers.
Very good. Pacifiers, there are pros and cons about pacifiers. The pro of pacifiers is that it calms babies down. It also has been shown to reduce the incidence of sudden infant death syndrome. One of the cons of pacifiers is it can affect...
Why is that?
Unknown.
Okay.
Unknown.
Yeah.
It may be because of the degree of arousability. Perhaps a baby that is sucking is a little bit more aroused, and perhaps that may decrease the chance of the baby stopping breathing. It's not truly known, but it's been shown statistically that babies that have pacifier babies have a much lower incidence of SIDS. Cons, on the other hand, pacifiers could possibly inhibit breastfeeding. Now, generally speaking, babies that are breastfeeding well, if you give them a pacifier, they for sure know the difference. Nothing's coming out of that pacifier, whereas something is coming out of the bottle or the breast. So it generally will not be an issue if the baby is being well fed from either breast or bottle. The one big problem with pacifiers is that it seems to be that there's an increased incidence of ear infections in babies that take pacifiers. So that is one of the cons. So there are pros and cons. Every baby is different. Some babies need a lot of sucking and some babies do not. If they don't have a pacifier, the babies need a lot of sucking. We'll find something else to suck. Many times it's the thumb.
Right.
So.
Many parents wonder, once again, especially when they're first-time parents, when is it appropriate to expect that the child can get toilet trained?
Toilet training is generally by about 2 that they have the ability to do that. Toilet training is a touchy area. There are several things that children always win. They always win when it comes to eating. They always win when it comes to sleeping. And they always win when it comes to toilet training. Winning means they get their way. If the parents show the child that they really want them to potty trained, you can almost guarantee that they're not going to be potty trained right then and there. They will take their good old time and do it at their own pace. But generally, the physiologic ability is around 2, and some will be able to do it earlier and some will be able to do it later.
Do you educate parents not to make it a big controversy?
Absolutely. We try to de-emphasize it, make it casual. They for sure know what it's all about. They've seen their parents do that, so they know what is going to be happening. And they do have the ability to control that for sure around 2. Sometimes it'll be a little later and sometimes a little earlier, but that's the time when we usually will introduce the subject.
If they force the issue, what are some of the consequences?
Consequences are of a child who uses toilet training to manipulate. They will hold it in. They will decide to go when they please. They will decide to do it at times when it's most inconvenient. And worst of all is that they won't decide to do it at all, potty train at all, until many, many months or years later. So we try to make this a non-issue as much as we can.
Thanks for that information. We'll be right back. We're back with Dr. Alan Gober, a pediatrician practicing here in Montgomery County. Alan, before the break, we were going through a potpourri of different aspects of childcare. Let's go on to discuss fever, something that can be frightening for young parents. So how do you define fever, and when do you say to parents, bring them on in?
Right. Fever is a subject which is, there's somewhat of controversy about fever. The biggest problem is defining what is fever. There are many different ways to take temperatures. Traditional way in babies, rectally, under the arm. There's ear thermometers. There are forehead thermometers. The problem is the accuracy of these, and they each measure temperatures in different ways and have different numbers and different standards. The classic Temperature, the one that is by the book, is the rectal for the infants and young children. Rectal temperature of 100.4, which is 38 Celsius, is the cutoff for fever. Anything less than that is not a fever, and you'll hear parents all the time, I always run 97, and when I get to 99, I have a fever. That may be the case, but by definition to us doctors, fever is 100.4 rectally. Oral temperature is 100. Now, there are some new technological advances that have been made. There is a new thermometer out, not so new anymore, of a forehead temperature. The forehead, it turns out, runs hot. The norm for fever, cutoff for fever, with forehead thermometers is 100.8. So because the temperature runs hot, this sort of validates grandma's old time saying, I can tell when my child has, or my children or grandchildren have a fever, I can feel the forehead and it's hot. Well, grandma may have been right. It does run hotter. So 100.8 is our cutoff for that. That corresponds to an oral temperature of 100 or a rectal temperature of 100.4. The ear thermometer, which many parents use, is not one of my favorites. And the problem with it is, if you look at that ear thermometer, the probe on that is much wider than the ear canal. The ear thermometer reads its temperature from the infrared rays, heat rays coming off the eardrum. If the probe is too big, you're not going to be able to get an adequate reading. So I really don't like that. The other one I don't like is underarm temperatures. Now, underarm temperatures are great. They're easy. They doesn't require disturbing of the baby. The problem is that if you get a temperature that is subnormal, you don't know whether there's a fever or not. Now, if you get a temperature under the arm that's over 101, for sure it's fever, because the underarm temperatures run the same or higher, same or lower, never higher than the rectal temperatures. So we like to try to get the temperatures taken at correctly. Now, once you have a fever, the problem is determining what's causing the fever. The fever itself generally does not cause a problem unless it gets to be extremely high, like 106 or something like that, which is almost never heard of. The body manages to get the temperatures down, but once you see temperatures up above that cutoff, we wonder what is causing the fever. Fortunately, most of the time, it's nothing very, very serious, but it should be determined what the cause of the temperature is, and that often warrants some discussion with the healthcare provider, the pediatricians and whatnot.
Does teething cause a slight fever?
That's one of the most common wives' tales that I hear.
Yeah.
Teething does not cause fever. But if you think about it, babies are getting teeth constantly. From about 6 months on, they're getting a tooth a month for 6 months, and then slows down thereafter. That is also the time when they're also catching these little viral illnesses. A baby has been shown to have 8 to 10 viral illnesses, some of which will cause fever in the first year of life. Now, if you're getting a tooth at the time you're getting one of those viral illnesses, you have a fever. And that's where that old wives' tale has come about.
Sure. As you know, one of the hot topics and concerns in the pediatric community is peanut allergy.
Yes.
Share with our viewers the spectrum of that and just how serious this issue is.
Peanut allergy is a very dangerous type of allergy. It can cause a condition called anaphylaxis, which causes the airway to swell up and difficulty breathing, as well as hives and rashes and sometimes vomiting. It can be life-threatening, and peanut allergen antigen is a very, very potent one. The problem is that for some unknown reason, the incidence of peanut allergy seems to have been increasing over the last 25 years or so. Recently, there has been some research to show that if a baby gets exposed to peanuts early, as opposed to later, we used to restrict exposure to peanuts until after a year of age. But they've shown now that if a baby gets exposed to peanuts early, there's a 10 times reduced incidence of peanut allergy by early exposure. So the recommendations are now to introduce peanuts to babies at 4 to 6 months of age. Now, you don't take a peanut and shove it in the baby's mouth. That's too dangerous. But there are products out there that have peanut powder, peanut protein in them. One of the original ones that was used is a product that is called Bamba. It is basically a corn puff, almost like a cheese puff, same type of thing, but it's made out of corn, and it's covered with peanut dust. And this provides a fair amount of peanut protein. The babies love it. Even the parents love it. It's not designed for babies. It's a snack of any type. And a baby, just you put one of these puffs in the mouth and it melts in their mouth. The babies love it. They get used to handling solids. It's a lot different than handling liquids. And if they have that on a daily basis regularly, then that seems to reduce incidence of peanut allergy. So in my practice, I try to get parents, even the ones that don't want to start food until 6 months, I try to get them to introduce peanut in some form to try to reduce the incidence of the peanut allergy.
Can you use peanut butter?
Yes, you can. You can use peanut butter. It's a little bit hard. You have to.
Yeah.
It's a difficult thing for babies to handle. But if you mix it up with some water or something, then sometimes even with applesauce, you can use that. There's the commercial products, and one commercial product out there that is peanuts mixed in a pouch with applesauce, and that same company has expanded to include other various nuts that can cause allergies as well. So there's plenty of opportunity to introduce the peanut. There's now research going on about other allergens. One, egg is a big allergen as well. So we'll know shortly whether or not that works for eggs as well.
If a child does have peanut allergy, is there any role for desensitization shots?
There are no shots for peanut allergy, but there are now something called oral immunotherapy, where you introduce tiny, tiny amounts of peanut to it's usually an older child, at increasing rates over the course of several weeks or months. And that has been shown to actually reduce the incidence of peanut allergy. Most of the child-infant allergies, child allergies, are outgrown by a year, 2 years, or later. Peanut allergy, only 20% approximately will outgrow it. So a big chunk of the population that's peanut allergic will continue to be so. So we're hoping to have some new approaches to that in the future.
And if somebody is at risk for an acute anaphylactic reaction, which could be life-threatening, as you said, do you recommend that they always have nearby an epinephrine pen?
Absolutely. There's the epinephrine pen, also known as EpiPen, but there are now several generics out. Anybody who has a potential for an anaphylactic reaction has to be taught how to use one of these, has to carry them at all times. The school has to have one, any place where they're going to be, because you never can tell where you're going to be exposed. Peanuts are mixed into a lot of different things, and it's if you may be going to a store and they may be sampling things, there could be peanut in that. So yes, you absolutely have to have an anaphylactic treatment available, epinephrine available for that.
And now many of the airlines are, as you know, are phasing out peanuts.
That's correct.
For that reason.
Yes, there are some people that are so exquisitely sensitive to peanuts that even if there's peanuts eaten and there's some of the dust gets into the air, that person can actually have a fatal anaphylactic reaction.
Right. Let's go on to discuss a very popular topic in households with kids, and that is a child comes up to mom and dad and says, "I'd like a dog." So what is the position of the Academy about pets in the household?
Yes, pets are actually very, very good for children. Pets are good for adults too, and there's lots of research now showing that pets are helpful in reducing stresses and hospitalizations and whatnot. But for children, it's wonderful because pets of any sort, usually it's going to be a dog or a cat, but there are fish and some of them have toads and whatnot. But pets are good for reducing stress. Research has shown it's reduced one of the major stress hormones, cortisol. Blood pressure is reduced by pets. Also, children have been shown to have increased focus after getting a pet. A lot of their schoolwork improves after getting a pet. So we do recommend pets for children, with one caveat. If you're highly allergic to some pet, that should not be in the house.
Sure. Now, some of our viewers may wonder, I've been out in the community and sometimes I see little children wearing a special helmet. Explain to them what that's all about.
Yeah, there's a problem with young infants where if they don't rotate the way they're lying when they're lying in their crib, they will have their head misshaped because the pressure will always be on one side. That is most of the time a very, very preventable type of problem where the parents are not paying attention to how the baby's lying, and the baby's lying in the crib in one direction, so the head gets flattened in that direction, and then the head is completely out of shape. To correct that, it's a big deal. You need to have one of these special helmets fitted for the baby that can reshape the head over the course of several months, and they have to wear these pretty much continuously, and they do work. But it is a problem which is largely preventable. The times when it's not preventable is where the baby is born with a misshapen head from its position in utero. In those situations, there's no preventing it. It has to be treated promptly in terms of shaping the neck to move the neck so the baby can move their neck, but also using these specialized helmets.
And share with our viewers, at what point do the different plates that form the skull fuse? So what?
Yes.
So that you no longer can manipulate that.
Right, that happens fairly quickly. The head basically stops growing at about 3 years, but a lot of these, what they call sutures, where the bones are fusing to one another, some of that occurs fairly early. We like to try to get these helmets done as early as possible, certainly before 6 months, but at the outset, less than 12 months.
Okay. Let's go on to discuss ADHD. What exactly is that?
ADHD is a commonly used abbreviation. It stands for Attention Deficit Hyperactivity Disorder. This is a biochemical brain disorder which is somewhat inherited due to variations or deficiencies of some of the neurotransmitters. These are chemicals inside the brain that allow the nerves to speak with one another. And when there's a variation in the neurotransmitter content in various areas of the brain, the result is attention deficit disorder. So this is clearly a biochemical disorder that causes children and sometimes adults to not be able to concentrate or focus or pay attention. Sometimes will cause hyperactivity. That's where the H comes, where they can be hyperactive and fidgety and not be able to sit down or keep still. It is a very, very controversial subject in terms of how to treat it. Being it's a biochemical disorder, there's been a lot of research to show that when you correct the biochemistry, you mean to correct the disorder. You don't permanently correct the disorder. You correct the disorder as long as you're taking a various medication. There is a lot of concern about medication. People don't want to give their children medication for just something as simple as paying attention. There has been nutritional advice has been given. The problem with alternative treatments is they just don't work consistently. The only thing that really consistently works is behavioral modification, where you teach the child how to handle various situations and improve focus, plus using the various medications that have been shown to be highly effective. It makes these children feel so wonderful about themselves. Once they start taking medication, they end up being able to get things done, and they start to feel so wonderful about themselves. And to see a child to be able to achieve when they haven't been able to is such a wonderful thing. And that's why we try to put up with some of the side effects, which are minimal and manageable. So it is a common condition, a difficult condition that impacts a child's life considerably. So,
Do they outgrow it?
well, that is a good question. Do you outgrow something which is biochemical? You probably don't actually outgrow the biochemistry, but what happens is other areas of the brain will develop so that you can adjust to that. If you have this condition, it may be that what the individual is doing is adjusting their lifestyle to their condition, and therefore may not be completely achieving their full potential. There are many adults, I have it back many years ago before ADHD became a common term. I had a child who was having clear-cut symptoms. Parents had no idea what this was, and I explained to them all about ADHD. And the father was sitting there listening while I was explaining this, and we started the child on medication, and she became a superstar, was one of the best kids in the class. The father was watching all this, and he decided to look into it, and because it sounded, this describes me.
Yeah.
And he determined that he had ADHD and ended up getting treated, and also within 6 months became advanced considerably in his business. So it was really nice to see that happening as well.
Very gratifying. Dr. Gober, thank you for joining us in House Call. If our viewers have any questions, how can they reach you?
They can call. I have an office, several numbers, 301-933-4210 is my Kensington, Wheaton, Silver Spring office. I have another office in Gaithersburg, 301-977-1103.
Thanks for joining us.
Thank you very much.
My thanks to Dr. Alan Gober for an excellent interview. My thanks to my team here at the station, and thanks to you at home. We are 6 years on the air and going strong. Let us know how we are doing. You can reach me at my practice website, montgomerygastro.com. As for our next show, it's going to be a very interesting one. Dr. Maria Sotomayor, a dermatologist here in Montgomery County, will be discussing skin issues. See you then next time for another edition of House Call. Good evening.